Welcome everyone to today's Turning Point webinar, Compassion in Healthcare. Are we on track or is there more that can be done? My name is Faye Stayos and I'm the Strategic Lead of Workforce Development at Turning Point, and I would like to begin by acknowledging the traditional custodians of the land on which we're gathered, which for me is the Wurundjeri people of the Kulin Nation, and pay respects to elders past, present and emerging. I would like to introduce our presenter today, Dr. Debbie Ling, a lecturer in the Department of Social Work, Faculty of Medicine, Nursing and Health Sciences at Monash University. Debbie is also a Research Fellow in the Epworth Monash Rehabilitation Medicine Unit, Epworth Healthcare. Debbie's doctoral research involved investigating the relationship between the perception of common humanity and compassion in healthcare workers. It produced world-first empirical evidence that the perception of common humanity leads to an increase in compassion in healthcare workers. She's been published internationally and presented at conferences in the US, UK and Ireland. Debbie is regularly requested to present on compassion training to hospitals and community organisations all around Australia. She sits on the Australian Compassion Council, Charter for Compassion Australia, and is a member of Australia 21 Mindful Futures Network Advisory Group. She also works as a senior clinician social worker at Epworth Healthcare. She has over 25 years direct practice experience in a range of fields, and we really do welcome her today. I do want to draw your attention before we commence to the chat. If you would like to ask a question, you ask a question directly to me. So just use the drop down to Faye Stayos and ask your question. It will come directly to me, and then we'll have some time after the presentation for Debbie to answer your questions. Can you please make sure that you have your videos off and your microphones off as well? I hope you enjoy today's presentation.
Okay, welcome everyone. So today the topics I'll be covering will be compassion in healthcare, so the Australian situation and internationally. In particular, the latest compassion research. So this is really the main impetus of my talk today and what I hope has the most benefit for people who might be listening, including healthcare workers, patients, families and leadership. So the implications of some of the compassion research, there's some very important findings that have come out now that can show how compassion can benefit healthcare workers and the patients. We'll also be talking a bit about barriers and facilitators of compassion, so the impact on health service delivery, and also the need for multi-level approaches, so both top-down and bottom-up. And I really welcome your questions towards the end because this is it's a really important topic. Obviously, it's a very challenging phase we're going through right now in Australia with COVID, and we could argue there's never been a time where compassion is more important. Next slide, thanks. So the definition I'd like to start with is compassion is the feeling that arises in witnessing another's suffering and that motivates a subsequent desire to help. So this is a widely accepted definition. As we all know, compassion is a core value in healthcare. So whether it's hospitals, non-government organisations, social and community organisations, you'll see things, they'll often have compassion as their stated core value, or it'll be mentioned in their strategic plan. You'll see phrases like this: our patients are at the heart of everything we do, or compassion is fundamental in healthcare. Now, I do want to pay a bit of attention to some similar terms which are not exactly the same as compassion. And this is very important. You'll see later on in my talk why it's so important to be clear about what we're talking about. This has implications for healthcare workers. So probably the term that compassion gets confused with the most is empathy. So empathy is the ability to understand another's emotion and share their feelings. So empathy is not specific to suffering. A person can have empathy with another person's happiness, whereas we need to remember that compassion is specific to another person's suffering. You also get compassion mixed up with the term pity. So pity is feeling sorry for another, but it has an element of looking down upon them. It doesn't have that element of respect. So you'll notice that hospitals and healthcare organisations, they never have pity as one of their stated core values. So they'll say, we offer you respect, integrity, but they never have pity. So that's one way of seeing the difference. And then sympathy is another term that's commonly sometimes mixed up with compassion. So that's feeling sorry for another, but not necessarily having a desire to alleviate their suffering. So sympathy is a kindly feeling towards another, but lacks that extra step of the motivation to act. And I'm just sort of reinforcing that in common conversation, it's quite common for people to use all these terms interchangeably. And in fact, it actually even happens in research as well, some research studies, and it's very important to get clarity on what we're talking about because it's got implications for the studies that we find. So really the basis of this talk is to really highlight some of the increased research into compassion. Compassion is a new field of research. It's in its infancy. So previously, up until probably about 20 years ago, compassion itself had not been a focus of research. But interestingly, what's happened is over the last 20 years, we've got the technology now to really drill down and look at the neurobiological basis of compassion, functional MRI studies, looking at objective physiological markers. So this has had a huge change on the quality of the research that's coming out and our understanding of what compassion is, how it differs to some of the other emotions. So you can see here on the left, the green flower is the Stanford Center for Compassion and Altruism Research and Education. They were established in 2008, and they also developed a compassion cultivation training course. This was an 8-week course, 2 hours a week. Prior to COVID, this course was only available in the States, so you had very few people elsewhere who had been through this course and trained to deliver it. But since COVID, these courses have pivoted online. And there's been randomised controlled trials done on these courses, and there's been other research to look at the effectiveness of them. University of California, San Diego, the Sanford Institute for Empathy and Compassion, they were given a $100 million grant in 2019 and set up with the express purpose to investigate the neurobiological underpinnings of compassion and empathy. And particularly their prime stated focus is to look at the phenomenon of doctor burnout. So in the States, there's one doctor a day who takes their life, and doctors' mental health and wellbeing is way below the average in the States. In Australia, the situation's not quite as bad. We have a slightly different health system, less pressures perhaps, but there's still quite a lot of discussion about the level of stress and anxiety and poor mental wellbeing of doctors and medical students. So it's a very important area. And UC San Diego, they're also looking at other interventions to help boost healthcare worker wellbeing in general, not just doctors. Centre for Healthy Minds, University of Wisconsin-Madison, they've been around for over 20 years, one of the key players in doing brain research, particularly investigating different mental states and mindfulness, meditation. Max Planck Institute for Human and Cognitive Brain Sciences in Germany have published some key work that I'll talk about in a minute. And then Emory University established a Centre for Contemplative Science and Compassion-Based Ethics, also in 2008. And they developed an 8-week cognitively based compassion training course that prior to COVID was available in the States. I think they're pivoting online now and have different online offerings. And in their course, there's quite a bit of emphasis too on perspective taking and certain ways of thinking, which I'll speak about in a minute. So having a brief look at the evidence regarding compassion in healthcare. Interestingly, data on compassion in healthcare, it's not routinely or consistently collected in Australia at this point in time. And that is understandable in some ways, given compassion is a fairly new topic of research. Then again, a comment would be that if you're not measuring something, then it's hard to track. There is variation regarding how patient experience and patient satisfaction surveys are collected, and the content of questions, it's not standard. I will say too, what's very interesting too in the healthcare space is, as mentioned, a lot of organisations have compassion as a core value, but it's sort of been assumed that healthcare workers can just do it or it comes naturally. And although the understanding is that compassion is something that we do have naturally as our evolutionary bent, you can see with the sort of thrust of this talk is there's an understanding that you can train and enhance it. So probably the most best effort we've got at the moment is the Australian Bureau of Statistics Patient Experience Survey that's run annually to report on patient experience of a number of healthcare services. So it might be GPs, specialists, hospitals, emergency departments. It's a big cohort, so the last financial year there were over 29,000 respondents. But they're asked a question such as, over the last 12 months, when you went to hospital, did the health professional listen carefully or show respect? And the feedback rating there is around 70 to 89%, which is reasonable, but there would be a comment that's not necessarily measuring the patient's perception of whether their care they received was compassionate. A brief look at just compassion in healthcare from an international viewpoint. So in 2011, there was a Harvard Medical School study where 1,300 patients were asked, is the US healthcare system compassionate? Now, approximately 50% said no, keeping in mind, as mentioned before, there are some very significant differences between the US healthcare system and the Australian one. Nevertheless, that's a high percentage. In the UK, there was a public inquiry into the Mid Staffordshire National Health Service in 2013, and this was as a result of widespread concerns regarding a lack of compassion from healthcare providers. What was discovered in some hospitals is there were patients who were not being cared for properly, and there was some very serious sort of lack of adequate patient care. Now, interestingly, this resulted in a 3-year compassion in practice policy in the UK. So, there was big uptake top down. We need to address this, have some response countrywide. And interesting, in the UK, at the political level as well, the importance of compassion has really been put front and centre. There's been an all-party parliamentary group focusing on compassion in politics with an express purpose of trying to help look at multiple ways to embed it in policy. So having a brief look here at some of the Australian articles and headlines. Now, I deliberately had a look pre-COVID, 2018, and before that, and I understand obviously at the moment, we're in a sort of an exceptional circumstances and the healthcare system's under immense pressure. But if you actually have a look prior to COVID, 2018 and the 20 years prior to that, there were lots of articles talking about burnout in the medical profession, shortage of nurses, burnout amongst paramedics. So just making the comment, and you've seen this come up in some of the commentaries on how to, the pressures that the healthcare system is under now. There's, one stream of opinion is that quite a lot of these issues were there before COVID, but COVID's now, sort of really blown it out of the water. And I mention this because it is important to try and look at a systems level how to address some of these issues. In 2018 too, there was a Sydney Morning Herald article, "More Compassion and Empathy Will Improve Our Health System." So the point was made that Australia does have a world-class public hospital system, but in the article the point was also made that nevertheless, there are instances where patients will say that they felt there was an absence of compassion and empathy. And in the article, the authors were saying that in the past, things like compassion and empathy have been considered soft skills. But the authors were saying we now know that you can train these things, you can help resource the workers, and so it's something that's important to put focus on. So in terms of benefits of compassion, this is a brief overview of some of the research over the last 20 years or so. There's a lot of evidence suggesting that the patient's physical health benefits when they feel they're on the receiving end of compassionate care. Psychological benefits for the patient, so the patient feeling emotionally and psychologically improved. There was one interesting paper, can 40 seconds of compassion make a difference? And I think it was patients were shown a burst of doctors speaking compassionately to the patient. And there were two groups. One group got that burst of 40 seconds, the other group didn't. And the group who even just viewing doctors speaking compassionately felt better. So that also draws your attention to the fact that when we see other people behaving compassionately, it can boost our own well-being. And there's a certain common sense there. Obviously, if we were in a health organisation or a hospital and we're seeing other people being spoken to in a sort of abrupt manner, that might raise our own stress levels. Data to suggest that compassion can lead to improved quality of care. And then one of the big keynotes is probably this fourth point here. There is data now showing that there are benefits for the healthcare worker, and this is what is really driving a lot of the impetus in compassion training. If you're wanting a fairly quick overview of some of the compassion research, there was a book called Compassionomics in 2019, written by two doctors from the Cooper Medical School, Stephen Tresiak and Anthony Mazzarelli, and that's quite a nice overview of a lot of the data looking at the benefits from compassion. So benefits for the patient, where they show better compliance, clinical management, increased pain control, so patients adhere more to their pain regimes if they feel that they've been on the receiving end of compassion, which leads to better quality of life. Benefits for healthcare quality, so reduced errors, improved safety and quality of care, improved patient experience, which leads to financial benefits for the organisation, and then also benefits for healthcare workers, where the reward network is activated, and I'll talk about that in a minute. This promotes well-being and can decrease burnout. I want to talk now about some of the important research that relates to some of the research findings with compassion. So it's helpful to understand that there's been a range of studies in different but related areas that are all coming together now quite powerfully where we're at now at 2021. So the social brain hypothesis is where there's an understanding that humans are social animals. We're wired to connect. Caring, compassion, cooperation, they're fundamental to survival. And in fact, actually, it's not just humans who have a lot of social connections. There's quite a lot of animal groups that will cooperate at quite a significant level. But nevertheless, there's an understanding now that although humans have a whole range of different propensities, caring, compassion, cooperation, without them, we don't survive as a species, or babies, young children can't survive without having all those things come in together. So there's a lot more emphasis now and interest in how these approaches operate, how they work and how you can promote them. One of the interesting studies is the Harvard study of adult development. So that I believe is the world's longest longitudinal study. I think it's 75 years, and it was tracking the health and mental well-being of over 724 American men. It started in the 1940s, and it was interesting. There were two different groups. So one group were Harvard undergraduates who'd come from a reasonably privileged background, so privileged enough to be studying at university. And they were contrasted with another group who came from a group of disadvantaged young men from one of the poorer parts of town. I think the study was in Boston. And these two groups were tracked every 2 years. I think they underwent a raft of tests on all sorts of things. So there was data on all sorts of things, and this was every year of their life. And interestingly, it was found by the age of 50, the strongest predictor of happiness was the quality of social relationships. So not quantity, it's not saying you have to have a huge number of social relationships, but the quality. And Professor Robert Waldinger from the Harvard Medical School is now the fourth study director. So because the study's been going so long, some of the study directors have passed away. And the study now is looking at the children of some of the original respondents. Some other important research is around how we relate to others. So there was an interesting study in 2011 by Valdesolo and Desteno called Synchrony and the Social Tuning of Compassion. And what they did was they had some pairs of people in the lab, and one of the pairs was a Confederate. And on one of the pairs, they were asked to tap in synchrony. So it's just tapping together. And with a different pair, they were asked to tap, but they weren't given the instruction to tap in synchrony. And interestingly, the pair that tapped in synchrony had a higher likelihood in doing pro-social actions towards each other. So this was quite a simple study, and as the authors said, it doesn't take much to get a sense of similarity. They said there's nothing special about tapping. It's such a small thing that can boost a sense of similarity. We've known for 40, 50 years, there's a lot of research on sort of in-group, out-group, group identity. We understand that people favour their perceived in-group. But crucially, a person's identity with different groups is malleable. So, and as we know ourselves, as we move through life, you know, when we're young and perhaps a student, that might be our group. Then as you get older, you may become part of a work group, or if you have children, you know, you then identify as a parent. So group identity is fluid, changeable, and this is very important. So in terms of some of the most important drivers for compassion research, some of the impetus has come out of studies of non-human primates and young children, young pre-verbal children, where it's been shown that they demonstrate altruistic helping, the desire to help each other. And there was also very interesting study. Nancy Eisenberg is one of the prime researchers in this area for decades, and she did a study on young children, I think they were about kinder age, where one of the children might get distressed and start crying. And interesting, what she found was some of the other children would then start crying as well. But there were other children there, their response to the crying colleague was to want to go and help and, you know, give them a hug or help them. So she noted that there can be different responses to someone else's suffering. So some of the young children went into distress themselves, whereas others went into compassion and concern for the other. And this is a very important finding. I'll talk about this in a minute. Also, C. Daniel Batson is one of the premier researchers in the area of sort of empathy, altruism for 30, 40 years, and he's also written lots of papers talking about having a clear understanding of compassion, which I'll also talk about that in a minute. One of the other big findings too, as mentioned, has largely been from neuroscience. So showing now that compassion itself leads to positive effect. So it fires positive neural pathways in the brain. So it's associated with feelings of warmth, concern, reward, affiliation. And I think an easy way of thinking about it is perhaps, the feeling a mother might have, to her 1-year-old. The 1-year-old falls over and hurts himself. The mother's usually, concerned, warm, caring. That's a positive neural pathway. The final point here is that there is important and continuing work to better understand the difference between compassion and empathy, which I'll now roll into to talk about for a few minutes. So one of the key studies here was in 2014 by Tanya Singer, Klemecki and her team. At the time, this was from the Max Planck Institute for Cognitive Sciences. So this was published in Social, Cognitive and Affective Neuroscience. The study that they did here was they put some people in the functional MRI scanner, showed them videos of people in distress, and gave them the instruction first off, have emotional resonance, have empathy with these people, try and feel what they're feeling. And they were able to see that if someone's in a lot of distress and you're trying to emotionally resonate with them, that's fatiguing and painful for yourself. Then that cohort were then given compassion training. So it's a different instruction where they were instructed to have compassion for the other. And they went back into the scanner and saw these same videos of people in distress. But the research showed that their brain networks were, when they were generating compassion, it was not a negative, painful reaction in their own brain, it was a positive reaction. So this study's been cited, I think, 600 times, and it's a sort of serious level of evidence to suggest that compassion training can be an antidote to empathic distress, which is something that's very useful, and I'll speak about that now in the next couple of slides. So it's important to have a bit of an understanding of just where we sit with empathy. So as mentioned, empathy's been around and been a subject of research for a lot longer. But we've really only had the technology to drill down over the last 20 years since we've had functional MRI technology. So empathy, put simply, you can say that you can have cognitive empathy, which is understanding and perspective taking, understanding where the other's coming from, or affective empathy, whereas the focus on feeling, emotional resonance. And generally in common conversation, when people talk about empathy, they're referring to affective empathy. Now the point is, if the person in front of you is suffering and in distress, effective empathy can then split down into two different responses. So you can see the red arrow is where the worker may accidentally go into empathic distress and feel distress themselves, which is triggering the pain network in their own brain. Or if they can stay focused on the other and go into empathic concern, which is similar to compassion, that's focused on the other, and that's not a pain response, it's a positive response. So to try and reinforce this diagram shows that put simply, there's three different responses we could have to someone else's suffering. So with the red arrow, we can go into self-focused distress, which is accidental, because we're wired to connect. If we go into resonance, that's one option. The yellow arrow is avoidance. So this is where workers, when confronted with the suffering of the other, we may want to look away or move on, and because it's painful. So one way of coping with it is to shift your attention elsewhere. And a similar example might be, say, you're walking down the street and there's, say, a homeless person on the street, looking, in a bad way. Sometimes we want to avert our eyes and keep walking because it's painful to see. So avoidance is one strategy. And then the green arrow is having a compassionate response to the suffering of another. So just highlighting that's a positive state of mind in the giver, and compassion obviously is the motivation for pro-social actions. So it's the best outcome for everyone. So compassion training can help the healthcare worker practice in responding with compassion rather than going into one of the other two responses. So in summary, for healthcare workers particularly, this is a key point, and particularly workers, there's a lot of frontline workers, first responders, particularly under COVID, there's immense pressure on mental health services in general. It is understandable if workers are going into avoidance withdrawal or empathic distress, and both of these they're very fast responses, so they're not even necessarily conscious. But for healthcare workers, longer term, it's not a productive long-term response. The avoidance withdrawal doesn't benefit the patient, whereas if we can have more compassion training where it helps workers have a better understanding of the difference, and we can help train and support them going to a compassionate response, it's better for everyone. So the workers gets the benefit of a positive state of mind, so it's good for them, but it can roll onto a benefit for the patient. The other thing to state too is with working in the field of compassion, there is an understanding that sometimes we may not always be able to alleviate the suffering of the other. That's a fact of life. Nevertheless, still having compassion helps build the worker's capacity for responding, and it can still be of benefit to the recipient. So for example, you would expect that in palliative care, there's a very high rate of burnout. That's not true, the data doesn't reflect that. So it appears that in palliative care, where the workers understand it's end of life, the focus is all on care and concern, making the person comfortable. The workers aren't trying to cure. So because the focus is on care, compassion, the actual workers' well-being is reasonable, and it's a better environment for everyone. So this third point's quite important. With compassion training, what you are trying to do is to train and help people change the behavioural sequence of how they respond to another's suffering, particularly if they've accidentally trained in going into avoidance or empathic distress. Because we can go into these states without even realising it. So I'll give a simple example. It might be you're having an extremely challenging day, and then a patient maybe, or someone's very distressed in front of you, and you could even just get the subtle thought of, oh, I can't deal with this today, or not today. It's very subtle, but that's a sort of self-focused pain response. Now, it's understandable, and these are not necessarily conscious, but nevertheless, it is firing pain networks in your own brain, and if you're to go into that often or regularly or habitually, it's not good for yourself. So part of the training is helping people to change the behavioural sequence, to notice the reward that we get when we go into compassion instead of distress or avoidance. So there's a lot of data around helpers high, that when people are helping helping others by choice, volunteering. Helpers high kicks in, there's benefits, I think it's dopamine, oxytocin rewards. So it can be slightly counterintuitive because particularly in the past, if we haven't been practicing the compassion, it can take some practice to keep trying to notice that we get a reward when we do go into that space. And it's very helpful to understand the process so healthcare workers are then motivated to keep practicing it, because compassion training is like any other sort of training. You improve with practice. It's a dose response. The more you do it, the better you get at it. I just want to talk briefly about emotional contagion. So there's a suggestion too that empathy is rooted in sort of a basic network, emotional response network called emotional contagion, and that's where there is a lack of differentiation between yourself and the other. So in empathy, you may still feel with someone, but you're aware that it's not your suffering. In compassion, you wish for the other's suffering to be relieved. And as stated before, it's a positive state of mind. You are not suffering yourself. So the distinction between self and other is crucial. There's a range of articles these days now talking about suggesting that the term compassion fatigue, which has had a lot of airplay over the last 20 years, is actually incorrectly named. It's actually empathic distress fatigue. Because compassion itself is a positive state of mind. This is just a very brief overview of self-focused distress. I think it's important to raise that there are multiple ways that we can get distressed ourselves, and keeping in mind we're all human. You know, it's a normal human reaction at times to get distressed. But as mentioned before, it's tricky if you're a healthcare worker and you're going into self-focused distress a lot of the time. So it could be by imagining the pain of the other, imagining you've got it yourself, getting distressed by others' pain, I wish they would stop yelling, or getting distressed yourself, thinking I can't bear this. Time pressures can be a big factor, and so this is where it's very challenging right now because, you know, we're understaffed with what's happening on with COVID. There's a lot of time pressure on workers, so it's very tricky. The less time you've got, the harder it is, obviously, to tune into someone else. And then there can also be distress due to self-competency doubts. So things like, how am I going to deal with this situation? So a section summary here is just reinforcing compassion is win-win. So that's why there's a great interest in training it up. And certainly in the US, where the compassion training courses originated and they've been around for 13 years, there's enormous interest in compassion training. It's been rolled out in lots of different sectors, not just healthcare as well, schools, leadership. So compassion is innate. We're born with the ability to connect and relate with each other and with multiple others. It's the best outcome for healthcare workers and patients. Compassion, crucially too, it primes the worker for action and focusing on solutions. So it's a complex human response where you have to have the perception first, is the other suffering? Then you have the empathy response. And then when compassion kicks in, you can kick that on to motivation. So there's just a reminder that empathy is also a very important natural human response. But in response to another's suffering, if we're staying in the feeling resonance zone for too long, then we can fatigue and that can lead to burnout. So compassion training can help mitigate against empathic distress. So you're wanting to help resource workers and help them learn to hold the space of the other's suffering and to be able to self-regulate themselves, but at the same time as having awareness of the other. And compassion also involves an acceptance of the human condition. So this recognition that there'll be different situations where people may have be in pain or be suffering, and we have a varied ability to impact on that. And there are some situations we can't alleviate, but we can still have a compassionate response. Perception of common humanity is something that I'm just going to talk briefly about now. So given that we've laid the groundwork for recognising that compassion it's important, it's desirable, it's a core value in healthcare, this is universal around the world, largely considered a noble and a virtue. Interestingly, we've now got the understanding in how to help train and promote it. So the question has been asked, how do you help people to have unbiased universal compassion, so compassion for anyone? Because we normally have it for our close others or people who are similar to ourselves. But particularly in healthcare, you want to train workers to be able to have that easily for anyone. So common humanity has been proposed as a prerequisite for unbiased universal compassion. This has actually been mentioned for decades across a range of modalities, so medicine, philosophy, religion, psychology. Common humanity is the perspective where everyone becomes the in-group on the basis of we all have the same basic human needs. There's a recognition of the universality of suffering in the human condition. So if we can train workers in common humanity, it can help strengthen the ability to have compassion towards anyone. Jinpa, who developed the Stanford Compassion Cultivation Training course and has written a book on compassion, says, holding in mind the following slogan, just like me, this person wishes to be happy and not to suffer, can be helpful because it's the most inclusive approach. It helps you view anyone, no matter how superficially different they might be, as just like me, they wish to be happy. So you can strengthen common humanity by sort of reflecting on certain aspects, and one of them is reflecting on interdependence. So a reminder that all humans are born helpless as babies. Each one of us required years of caregiver input to survive. It's something that we don't normally think about. Each of us has been the recipient of many resources, so food, housing, teachers, schooling. We're interconnected with lots of people, some of whom we don't know, farmers who grow the food we need to eat. So there are multiple others who have benefited us, even in minor ways, which we often don't recall. So it can be helpful to pivot and focus on this, particularly in these days. A lot of the, some aspects of the news and social media can be very polarising, and it's emphasising difference instead of emphasising some of those baseline shared humanity aspects that we have. So it can be very useful too to recall a time when we ourselves were on the receiving end of kindness and compassion from others. So as mentioned, we don't reflect on this regularly, and certainly in some of the training I run, we spend a bit more time to nuance this out. And it can be very helpful to appreciate the role that others play in our lives and the role that we may play in the lives of others, however fleeting. And I'll just mention briefly, some of you would have heard of the Eurythmics, which was a British pop band, very successful in the 80s and 90s. And by chance, I heard an interview with Dave Stewart, one of the band members, last year. And he's talking about the success they had over the last 30, 40 years. And he says before they got successful, they were poverty-stricken and things were not going well. And they were desperate, and they decided to go to the bank manager and ask for a loan so they could buy a guitar and electronic equipment to make their first record. And interestingly, the bank manager, against the odds, they felt, did say yes, loaned them the money, and that went on to be the first big hit record they produced. And I thought it was very interesting that 40 years later, he's talking about this in an interview and saying, remember those who helped you along the way. And I think it's a very valuable activity to do. So a brief reflection is to try and think of all the people who've ever helped, supported, or had a positive influence on us at any time in our life, so not just primary caregivers. And when I run these exercises in training, you get all sorts of answers. So there was a young mental health worker who was saying she gets the same bus to work, and the bus driver always has a different joke every morning to tell. She said it just cheers people up and sets her in the right mood for work. And someone else was talking about how they were going through a difficult time, and just went down to the local shop, and the shopkeeper just gave them a nice smile and said hello. So it can be something quite fleeting, and it can be helpful to remember this, so that particularly us as healthcare workers, it can heighten our understanding that some of those small things can make a difference, those moments of connection. So that's another thing that can be useful, is to recall a time when we extend compassion to someone else. Keeping in mind, in our work, it may be something that we do a lot of the time, but it can be helpful to just explicitly focus on it as well. So I've been talking about common humanity, and I'm pleased to mention that Monash University was given a $12 million philanthropic grant from Martin Hosking, the founder of Redbubble, to set up the Centre for Consciousness and Contemplative Studies, which will be launching next year. It's a world-first interdisciplinary collaboration between philosophy, neuroscience, medicine, education and interfaith, with the stated purpose to look at common humanity, research, education and community engagement. So this is really exciting. There's lots of opportunities here, having such a broad interdisciplinary focus. And for example, there's been high demand on scalable compassion training options to try and help get some of the latest research and techniques out on how to resource healthcare workers. So we're currently building a online compassion training short course, which we hope can be easily scaled up. That'll be released next year. Another exciting thing is we've currently got a team together and we're collaborating with international researchers on functional MRI research in the area of common humanity. And on team we have a neuropsychiatrist, a psychologist, a philosopher, a medical doctor and a social worker. So there's a lot of strength that can be gained from having very different discipline focuses coming together, sharing, cross-pollination. So this is a sort of brief summary page on some of the barriers to compassion, and I've put multiple demands and time pressures up the front and systems issues because, as we all know, particularly now under COVID, where we've got staff having to do double shifts or a shortage of doctors and nurses, there are limits to what workers can do, and in lots of healthcare organisations they may be under-resourced. So we have to be realistic when there are multiple systems issues. We have to adjust and do the best we can where we're at and be adaptable. Obviously there can be challenging worker-to-worker interactions. So with compassion training, it's not just from the healthcare worker to the patient and family, but it's also healthcare workers to each other, leaders to the workers. As you can see from this presentation, there is an emphasis on trying to heighten individuals' workers' understanding of just their own awareness of their own mental state, whether they're distracted or not, whether they're able to tune into the other, the particular judgments that they might have about the other. So these are all things that can be, we can help workers focus on to optimise it for compassion. So facilitators of compassion, as mentioned, we think education on the science behind compassion and positive emotions is crucial. It's really important to get this knowledge out there so more workers have an understanding of what's going on and a better understanding of some of the underlying mechanisms of compassion as we understand them at the moment. Even having a basic knowledge of that is useful. To understand the difference between compassion and empathy is critical. And it's mentioned to help mitigate against empathic distress. To have an understanding of the varied responses one can have to another's suffering. So it's context dependent. We know ourselves on any particular day, our response can vary depending on what else is going on. So understanding that it is context dependent, it's relational, can be affected by time pressures and snap judgments. And so this is where it's so challenging because part of the work that we do, we are having to make judgments on a regular basis, on a rolling basis, back to back. But part of this training is helping heighten workers' understanding of the types of judgments they're making at key points. Recognise the early warning signs in yourself. So if you're feeling particularly stressed, to recognise, okay, today it's a tough day, I'm really feeling stressed, let's just take a couple of breaths, calm down, reset. And when you do have an instance where it was difficult to get to compassion, it's very important and useful to unpack it later, debrief, try and work out what happened, what was the pressure point, what could I have done differently. So strengthening common humanity to be the default position, just like me, this person wishes to be happy and not to suffer. Being able to regulate emotions, supportive workplace culture. So we do need a multifaceted approach. Although I've spent some time talking about the bottom-up approach of compassion training at the level of the individual worker, that's very important. It's not enough. We know from COVID there are limits to staff capacity, healthcare worker shortages, systems issues, so we do need top-down change as well. Systems in healthcare are interrelated. Tweaking one aspect of a system can have a flow-on effect to others. Really important and useful to collect and analyse the data on why staff leave, what makes their job difficult, which interactions are they finding challenging, why. Collect this data so we can have data-driven approaches. I think it's very helpful to incorporate checklists and pause points for compassion. And I draw your attention to Atul Gawande, who wrote the Checklist Manifesto. He's an American surgeon and he did a TED talk on this where he was talking about ways of saving lives in surgery by just having simple checklists for the critical points and having pause points at an important point. And I think this can be very helpful. For example, we often have a one-page PDF everywhere now, the five moments of hand hygiene. You could have something similar, the 5 moments of compassion, given that there's agreement that it's so important. And also greater collaboration with researchers to trial innovative interventions. So interdisciplinary approaches are really helpful, very important. The neurobiological basis of compassion and empathy, there's already a lot of work in this area, which is crucial, looking at testable concepts. Very important to understand how workers think, which perspectives are more useful, which are less useful. We absolutely need both the hard science, but also the human stories to make it real. An understanding of contextual factors and environment, how to humanise healthcare. And also looking at patient experience, worker experience, leadership experience, drilling down to everyone's viewpoint, seeing where they align, where they don't. And finally, the spirit of innovation to work towards scalable solutions. I've just put some resources here. So I think we're going to move on to Q&A now.
We are. Thank you, Debbie. That was absolutely wonderful, and I'm sure you have provided a wealth of information to our audience, and they have provided some questions. So I'll ask the question, starting with the first one, which is, do you think we could have compassion embedded in Australian policy?
Thank you for that question. I think absolutely. If UK can have it embedded in their policy, I don't see why it can't be embedded in Australian policy. And in fact, it's crucial. You absolutely need these top-down driven approaches as well. So that would be wonderful. And a comment to make too is compassion's already been embedded in a lot of social and emotional learning programs that are now being rolled out in schools and kinder. So that's the way forward, is you have this pervade society. It's such an important thing.
What can be done to increase compassion across public and community services while still being effective money and program managers?
I think there needs to be an understanding. In that question, there's sometimes a sense that compassion may be at odds with effectiveness of the program and with the outcomes that the healthcare organisations have. And I would encourage people to go and have a look at that book, Compassionomics. There's a raft of data suggesting that compassion actually improves the business bottom line. You've got happier workers, more productive workers, happier patients. So it's understanding that compassion in itself is actually crucial for the bottom line. And I think one of the challenges is that there can sometimes be some misunderstandings as to what compassion means. So sometimes people think compassion means letting others do whatever they want. And that's not the case. Compassion is a concerned response to another's suffering with a desire to alleviate that suffering. But you can still have compassion and be kind, but be firm. There's still boundaries that are at play. But certainly the data suggests that compassion is good for business, which seems a strange thing to say, but nevertheless, that seems to be what the data is suggesting. And it's also crucially, though, the best thing for the patients and service users as well as the workers.
Is there a difference between gratitude and reflection on interdependence?
Gratitude's a really important topic, and thank you for asking that question. So gratitude's crucial, and gratitude is where we're reflecting and we're grateful on the things that we have, the benefits we've received from others or some of the good things that are going on in our life. And it's a specific focus where there's increasing research interest on gratitude. And whereas with interdependence, focusing on that can include gratitude, but you can also focus on interdependence in ways that aren't necessarily looking at just the benefits that you've received from other people. So for example, today, those of you who are listening to this presentation, there's been a whole range of factors and technical expertise that have come in to get this happening. So that's an example of interdependence.
Okay, and is there any practical tips for managers to assist their staff in compassion, aside from the formal training, or could you pick the most important top two, say?
Top two. I think aside from formal training, you're definitely looking for culture change. So you're looking for cultural workplace change, top down, bottom up. And so I think a training course is crucial too, and I'm not suggesting that alone is enough either. you are looking really for managers and leaders. I think it's been very powerful when they've embraced this and really brought it into the organisation, because ideally you would want a raft of different responses and things like there can be compassion training, which could lead on to other groups that are set up for peer support, debriefing, the Schwartz Centre for Compassionate Healthcare, which I mentioned, it's in the resources in the slides. They're a large American not-for-profit that have been around for 20 years, and they established the Schwartz Rounds, which is a dedicated program that healthcare organisations can have, where it might be once a month, all the workers get to come to a Schwartz round and talk about the impact of their work and the impact on them as humans. So you need a range of responses to really help embed this stuff. But I think the first and most important thing is for managers to become interested in it and then think about what they can do, what tasks they can do to help resource the whole organisation and the workers that they're responsible for. Because the top-down approaches in some ways are very effective. I've certainly had some CEOs and managers who've embraced this stuff and they've said, right, let's just roll this out to the whole organisation in scalable ways. So they've considered it so important that they want all their staff to have access to even a shortened version of the training. So managers are crucial in helping this really scale up.
Well, that concludes our questions. So thank you very much, Debbie, for this amazing presentation, very valuable. I have put in the chat that we will have slides available, and we will also have this recording available shortly for everybody as well. But thank you, and thank you to our audience for participating today. And thank you.
Thanks very much.